How common are protracted withdrawal symptoms from psychiatric medications? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the questions that's come up a few times is how common really is protracted withdrawal, which is also called post-acute withdrawal syndrome or PAWS. And the short answer to this question is we don't know exactly. And that's because most of the studies that have looked at the safety and efficacy of our psychiatric medications, both taking them and coming off of them, have been funded by pharmaceuticals and are short-term studies, usually on the order of 8 to 12 weeks. And so most cases, that's not enough time for someone to develop enough dependence on these medications to have severe protracted withdrawal symptoms. However, I say most. This is not absolutely the case for everyone. We do have a little bit more evidence for benzodiazepines because this is something that has been in use for a longer period of time, and it's more broadly accepted that there are significant withdrawal issues with benzodiazepines, both acute and protracted. So there have been some studies to show that 10 to 15% of long-term benzodiazepine users developed protracted withdrawal symptoms, especially with abrupt discontinuation. With antidepressants, we have much less data. And of course, all of this is going to be retrospective patient reporting, which does lend it to things like recall bias and selection bias, meaning that people may recall things differently because hindsight is 20/20, or the people who are more likely to participate in these studies may be more likely to have had a negative reaction. But all that to say that there have been some studies to show that up to 20% of people have experienced protracted withdrawal symptoms for up to 3 months after discontinuing an antidepressant, and then 10% have had withdrawal symptoms lasting for over a year. Whereas other studies have showed that up to 90% of people developed protracted withdrawal symptoms after stopping a psychiatric medication. So the estimates are all over the board. As far as clinical experience, I think it really depends on whether or not you are looking for this, because it is very common in current clinical practice to mistake withdrawal symptoms from antidepressants and other psychiatric medications for a recurrence of illness, like worsening anxiety or worsening depression, when this is not the case. If you were to ask me coming out of training how common this was, I would say it almost never happens. I've never seen it before. However, once you become aware of the concepts of protracted withdrawal, what that can look like, what to be monitoring for, you realize that this is way more pervasive than you ever thought before. Now, it may not be to the same extent that people who have really severe protracted withdrawal injuries have, where their functioning is completely impaired and almost every system in the body is affected. However, there are definitely a lot of cases where people are experiencing this, maybe to a lesser or less severe degree. And it's not something that we are routinely monitoring for in mainstream psychiatry. But my hope is that with growing awareness of this issue, that we will start to get good studies on this and that we will get better at picking this up in clinical practice, and that there will be some movement in a positive direction for the field in general, but also for the patients who have suffered as a result of lack of understanding about this. If you're interested in getting more direct resources or content from myself, I do have an email list and I send out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.